Heart disease, or more accurately cardiovascular disease, is our biggest killer here in Australia. In fact, an Aussie man or woman dies every 13 minutes here in Australia. It kills 3 times more women than breast cancer, yet it kills double the amount of men. And what this all means is that cardiovascular disease impacts our well-being more than anything else. So what is cardiovascular disease? Well, the most common and serious types of cardiovascular disease include coronary heart disease, stroke, and heart attacks. Coronary heart disease occurs when an artery that supplies blood to the heart muscle becomes clogged, narrows, and becomes stiff due to the build-up of plaque. Now, this build-up of plaque happens over time and mainly occurs because of too much bad cholesterol, the LDL cholesterol in our system, due to genetics, poor diet, not enough exercise, smoking, or stress. If this build-up of plaque leaks into the bloodstream, it reacts with the blood and it will clot instantly, and this can cause a heart attack. So if you ever feel pain, pressure, heaviness, or tightness in your chest, neck, jaw, back, or shoulders, and these symptoms continue even after resting quietly for 10 minutes, you need to take action straight away by calling 000. The longer a heart muscle is deprived of oxygenated blood, the greater the damage. Stroke is similar to a heart attack in that a stroke happens when blood supply to the brain is interrupted. Remember, arteries also carry oxygen-rich blood to the brain, and in the case of stroke, 8 out of 10 times this disruption in blood supply occurs because the artery is blocked, although strokes can also be caused by arteries bursting or hemorrhaging. The problem is that when brain cells don't get enough oxygen or nutrients, they die, resulting in brain damage. So that's why the Stroke Foundation promotes the FAST test. FAST stands for face, check their face, has their mouth dropped, arms, can they lift both their arms, speech, is their speech slurred, do they understand you, and time is critical. If you see any of these signs, call 000 straight away, and while you're waiting for the ambulance, follow the ambulance call taker's instructions. 9 out of 10 Aussies have at least one modifiable risk factor for heart disease, and 2 out of 5 of us have 3 or more. Some of these risk factors you need help with, some are entirely under your control. Risks that you'll need to chat with your doctor about include blood pressure. This is the pressure of the blood on your arterial walls. The higher the pressure, the more danger it is for your heart. Aim to keep it below 140/90. Cholesterol. We want your total cholesterol, the amount of good and bad, to be less than 4, and we want your LDL to be less than 2.5. Next is diabetes. If you develop diabetes, you're at greater risk of cardiovascular disease. In fact, 70% of diabetics die from cardiovascular disease. The good news is that what's good for diabetes is also good for cardiovascular disease. Then there's the risks that are up to you. Smoking is the biggest risk for cardiovascular disease. In fact, it's been estimated that smoking increases your risk of stroke, coronary heart disease, and even impotence by 100%. Just 1 to 2 cigarettes a week increases your chances of dying prematurely by 2 to 5 times compared to a person who doesn't smoke. When it comes to what we eat, the research is now clear. Adopting a plant-based diet is the best way to protect yourself from cardiovascular disease. A diet high in plants will help keep your blood cholesterol low, allow you to get the good fats such as olive oil and omega-3s, and keep the salt low, especially sodium that's found in processed foods. Now, obviously it's crucial that we move for the health of our heart and its pipes. Getting 150 minutes of moderate exercise, this is where you can briefly talk, or 60 minutes of vigorous activity, that's the hard huff and puff stuff, will reduce your risk of cardiovascular disease by about 30%. The final modifiable risk factor is our weight, or as we like to call it, excess stored energy. When it comes to weight, don't worry about your BMI or the scales, just measure your waist. For men, if you're Asian, Aboriginal or Indian, if your waist is greater than 90 centimetres, your risk is high. For the rest of males, if your waist is greater than 102 centimetres, you're also high risk. For Asian or Aboriginal females, high risk is when your waist is greater than 80 centimetres, and non-Asian or Aboriginal females, high risk is 88 centimetres or more. If you're wondering where to measure, just use your belly button. On top of all that, one of the best things you can do Once you hit 45, book in for a heart health check. A heart health check involves checking your blood pressure, cholesterol and blood sugar levels, along with a chat about your lifestyle and family history. From there, your GP will use that information to assess your personal risk of having a heart attack or stroke in the next 5 years, and most importantly, what you can do to lower that risk. As we said earlier, cardiovascular disease is the #1 killer of Aussies, and it's the most common cause of poor health. The problem is that cardiovascular disease is often silent. That's why it's so important to control the things that we can influence. Things like regular movement and raising the tempo when able, feasting from Mother Nature's garden, falling in love with your plants, dodging the darts, keeping your waist lean, whilst also keeping your blood pressure and cholesterol at healthy levels. And last but not least, build that relationship with your GP so that they get to know you and can help you identify and control any risks you may not be aware of.